Hello, welcome to Health and More. Today we have a very important topic, which is cancer. Cancer, if not detected in time, can and will kill you. But to avoid cancer, there is a series of ways you can live life. Today we will talk about pancreatic cancer. With us, we have a friend of mine back from college, Dr. Pozo. Hello,
Hi.
Pozo.
Good evening.
So tell us about pancreatic cancer.
Well, pancreatic cancer, as you can tell in the name, it starts in your pancreas, and it's most common in people aged over 60. I brought some research paper from my college today, and it shows how and what affects the pancreas in this process. Well, pancreatic cancer begins in the tissues of your pancreas, which is located in your abdomen behind your stomach, or a gut as most people call it. And your pancreas secretes enzymes that aid digestion and hormones that help regulate the metabolism of sugars. Pancreatic cancer often has a poor prognosis, even when diagnosed early. Pancreatic cancer typically spreads rapidly and is seldom detected in its early stages, which is a major reason why it's a leading cause of cancer death. Signs and symptoms may not appear until pancreatic cancer is quite advanced, and complete surgical removal isn't possible. Here my friend Rogelio told me he has a diagram to show us how the pancreatic...
I prepared a diagram today to show, to help you get a wider understanding of pancreatic cancer. So the pancreas is located, as my friend said, in the abdomen near the stomach, intestines, and other organs. Here's a picture from Terrace Winslow back from 2009, which shows the pancreas. It consists of the tail, the body, the head, the bile duct, and the pancreatic duct.
You can think of the pancreas as a tadpole. You see, the tail and body and head mostly represent and look like a tadpole. And, well, pancreatic cancer, as I said, mainly occurs in people aged over 60. But it can happen in teens and adults.
It is very rare, though.
It is very rare.
Pancreatic cancer arises when cells in the pancreas begin to multiply out of control and form a mass. These cancer cells have the ability to invade other parts of the body. There are a number of types of pancreatic cancer. The most common is the pancreatic adenocarcinoma. Accounts of about 85% of cases, and the term pancreatic cancer is sometimes used to refer only to that type. These adenocarcinomas start within the part of the pancreas which make digestive enzymes. So, tell us a little bit more.
Well, if it is diagnosed at an early stage, pancreatic cancer can be stopped. Then an operation to remove the cancer gives some chance of cure. In general, the more advanced the cancer, the more it has grown and spread, the less chance the treatment will be curative. However, treatment can often slow the process of the cancer. So, when patients have been found with pancreatic cancer, they are given a certain type of medication to slow down the pain and the process of it spreading. Total surgical removal of the pancreas is not possible.
Since early pancreatic cancer usually does not cause recognizable symptoms, this disease is typically not diagnosed until it has spread beyond the pancreas itself. This is one of the main reasons for the generally poor survival rates. Except to this are the functioning pan-nets, which overproduction of various active hormones give rise to symptoms according to the type. Bearing in mind that the disease is rarely diagnosed before the age of 40, common symptoms of pancreatic adenocarcinoma occur before diagnosis include pain in the upper back abdomen, whites on the eye, unexplained weight loss, and nausea.
Well, we've been talking about pancreatic cancer, but what is the pancreas? The pancreas makes a fluid that contains enzymes or chemicals that are needed to digest food. The enzymes are made in the pancreatic cells and are passed into tiny ducts, which, as you can see, is the pancreatic duct. These ducts join together like branches of a tree to form the main pancreatic duct, as I just pointed out right here. These drains the enzyme-rich fluid into the duodenum. The enzymes are in an inactive form in the pancreas. Otherwise, they would digest the pancreas itself. They are activated in the duodenum to digest food.
So, age. The risk factors of pancreatic cancer are a lot. Risk factors for pancreatic adenocarcinoma include age, gender, and race. The risk of developing pancreatic cancer increases with age. Most cases occur after the age of 65. While cases before age 40 are uncommon, as my colleague said, this disease is slightly more common in men than women, and in the United States is over 1.5 times more common in African Americans. Cigarette smoking is the best established avoidable risk factor for pancreatic cancer, approximately doubling risk among long-term smokers. The risk increases with the number of cigarette smoke and the years of smoking. The risk declines slowly after smoking cessation, taking some 20 years to return to almost that of non-smokers. Obesity, a BMI greater than 35 increases relative risk about half. So, family history is only about 5 to 10% of pancreatic cancer. Cases have inherited component, where people have family history in pancreatic cancer. The risk escalates greatly if more than one first-degree relative has suffered from pancreatic cancer.
So what you're saying is that pancreatic cancer can be inherited?
Yes, it can be inherited, but it's very rare. Only about 5 to 10%, as I said before.
And what other causes of pancreatic cancer? Because as you said, tobacco is largely a cause of most cancers, like lung.
A very high cause here in the U.S. is alcohol. Drinking alcohol excessively is a major cause for chronic pancreatitis.
Chingado, güey. Chingado.